from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
9:07 is the time. Welcome back into Good Morning Arkansas. For those with high cholesterol, you start trying to lower it through diet and exercise. But when that's not enough, you probably start taking cholesterol-lowering medication, usually a pill every day or something like that. But what if someone told you you could actually just take a shot once a month instead of that pill every day? Well, does that work? Here with new research to tell us if this is a good option for you is Baptist Health cardiologist Dr. Scott Davis. Good to see you again.
Hey, sir.
Thanks for coming in. This is something that I think a lot of people out there would be interested in because the daily medication routine after a while can become, old. It can become tough for some people, forgetful, or maybe leave it behind and go, how am I going to take this? This is an option maybe for them.
So show and tell, right? Visual aids.
What do you got here?
So there's new injectables, and we've talked about this before, but just as an introduction, there's a host of data that shows about being on a cholesterol medicine, being on a statin, Lipitor, Crestor, Zocor, and getting your cholesterol down lowers your risk for having a future event, heart attack, stroke, etc.
Okay.
And so, but what the next wave is going to be these injectables, okay? And so there's two medications. There's Repatha, which is this guy.
Okay.
There's Praluent, which is this guy. This is guys twice a month. This guy's once a month on the injection. So you're familiar probably with an EpiPen. You got a new baby, right? And they probably talk if you have an allergy and it might need an EpiPen.
Sure.
And you just press the button and inject it under the skin, usually in your abdomen. This doesn't have a needle in it, but it's just for instructional purposes. Yeah. But here's the notion. Currently, now this is available for folks who otherwise fail cholesterol medicine, right? Mm-hmm. They develop a side effect. They can't take the statin. They get the muscle aches, liver issues, and they can't take it. This is offered, or they're not to control, they're not to level where they want to be, need to be as far as maxed out on a cholesterol medicine. So you're taking 80 milligrams of Lipitor a day and your cholesterol's still high. This is where this comes in. Now, hopefully, as we evolve in our research, that this can become an option and an alternative to, like you say, taking a pill a day. But the data on this, it's a totally different pathway through the liver, and the data on this is now 4 years worth of data on this Repatha medication specifically that shows it's safe and it's effective. In other words, folks still have markedly reduced cholesterol levels. Their LDL, the bad cholesterol, is still, at rock bottom, and yet there's been no side effect profile long term. So these are brand new medicines that have come out, and yet now we got 4 years worth of data. That's the thing we talk about is like as these new therapies come out and as these new studies come out, whether it's looking at a medication or it's looking at something that might be negative for you, like an electronic cigarette, right?
Yeah.
And we've talked about that. And so this is now more robust data that shows, all right, now we got 4 years worth of data looking at these injectables and they're safe. And so it does kind of set the stage for the possibility as we move forward. Could this, not saying it will, but could this then replace taking a pill a day as an option for folks? And that's where we are on the whole research side of it.
Are you encouraged by stuff like this?
Absolutely. Yeah. I mean, look, I'm a physician. I find it hard to take a pill twice a day, much less 3 times a day, right? So anything you can do to reduce frequency of medication, your compliance goes up dramatically. So by taking a pill a day, that's better than, your compliance is better than taking a pill twice a day or 3 times a day. If you can move to an injectable once or twice a month, I mean, your compliance will then skyrocket. And this is a totally different pathway as far as the way it works, its mechanism of action. In other words, its actual metabolism in your body. And it's a totally different pathway that doesn't put your liver in harm's way, and its side effects are just basically nil.
Wow.
So it's very encouraging stuff.
Okay, hopefully this is something like you said that in the future. It's still obviously in that stage
and
where it's
Star
being
Trek
introduced.
Kind of stuff, you know? I mean, it's great.
It is. It's pretty cool. Scott, thank you so much for coming in this morning, buddy.
Man. Good
we
to see you,
appreciate
Chris.
you stopping by and explaining what all this means, because you probably hear us read news stories about this stuff all the time and wonder, well, is this something right for me? Well, we've got Baptist Health in here to explain really what it means for us here in Arkansas, what it means for you as a patient. Baptist Health Helpline, of course, on your screen, but you can always go to baptist-health.com as well if you'd like to find out more information.